Continue with our build-up coverage to that family meeting at 8 p.m., which will be live here on eNCA. The Western Cape is going to be the big focus because it has now more than 10,000 active coronavirus cases and accounts for a third of the country's active COVID caseload. Along the Garden Route and in Cape Town, hospitals are under pressure. Let's now speak to Dr. Kerrin Begg, who's a public health specialist at UCT. Dr. Begg, thank you so much for your time. Compared to the height of the first wave in Cape Town, how bad are things in the Western Cape right now?
So I think that we certainly are worried because we're having increased numbers of positive cases. We are having increased hospitalizations and a slow increase in deaths as well. And so that's always worrying. But we're certainly nowhere near the levels that we were at the peak. So we're about equal to the downside of the peak in August in terms of where we are at in cases at the moment.
There's a big concern around health workers. We're seeing an increase in infection amongst health workers, and we were hearing from health authorities in Cape Town that there's a correlation between the infection among health workers and also the rise in infection in communities where they live. What's the better way to protect health workers? I know in the past some people have come up with suggestions that maybe let's make sure that there's accommodation provided for health workers away from home in areas where there's heightened and there's a rise in infection. Some people rejected that. What do you think is the way to protect health workers and to ensure they're not carriers when they go back into their communities?
So let's just clarify something around healthcare workers, that we've done quite a lot of work on investigating healthcare worker infections. The vast majority of them actually are community acquired and not getting their infections at work. In fact, the safest place that they probably are is at work, because they're focused and concentrating on their PPE, on all of the mitigating transmission. So very few healthcare workers have actually been infected at their place of work through patient contact. Where they have been infected at work, it is because they've dropped their guard in the tea room. They've usually been infected on their way to work in transport, similar to any other person accessing work. And in fact, the level of infection in healthcare workers is not that dissimilar to community infections. So the vast majority of healthcare workers are infected in the same way as other community members are infected, which is at home, in communities, congregating in groups, in tea rooms, at work, and in transport.
Yeah. So what interventions are needed then? The President is going to be announcing a number of interventions to curb the spread of this virus. What do you think are the urgent interventions that are needed? Do you think we can still stay at lockdown level 1 restrictions with a number of localized restrictions, especially in areas that are a big concern?
So remember that lockdown is quite a blunt instrument, and particularly a countrywide lockdown is quite a blunt instrument. And so we always use that quite with limited, we prefer not to use it because it really is such a blunt instrument. However, so what we call circuit breakers, so mini lockdowns or at least partial lockdowns, are very helpful just to give some breathing room for the health system and for to stop interventions. So the main things that we need to stop are amplifying events. So those are groups where people congregate, and being able to stop those and having many outbreaks and cluster events is what we really need to be stopping at this point. So I suspect that the President may announce restrictions to events, curfews which limit the duration of events, and also perhaps some restrictions to alcohol. We certainly know that alcohol usage, particularly when it's not related to sitting down at a meal, does increase or decrease inhibitions, which means that people take risky behaviors, which means that they're not necessarily putting on masks and concentrating on keeping physically distant from others. So I suspect that those may be some of the areas that the President is going to make some announcements on. Similarly, in terms of travel, so importing of cases to areas which may have low incidence at the moment, And certainly as we're coming up to the festive season, I suspect that there may be some announcements around restricting travel so that we don't end up taking the higher rates of provinces at the moment into other provinces where there are lower rates at the moment.
Yeah, and I suppose that's going to be a very complicated one to implement should government decide on that when people are looking forward to spend some time with their families. Just lastly, how important is education around those non-pharmaceutical protocols? Because I've heard a lot of health authorities talk about a lot of people, actually the transmission occurs when people sometimes don't know yet that they've got the virus, which then emphasizes the need for one to wear a mask at all times. How important is it that maybe government then focuses a lot on that education in communities for people, yes, understanding that they are fatigued by the lockdown, but understand that wearing those masks and implementing those safety protocols, those non-pharmaceutical protocols, is very much important during this time?
Absolutely. In fact, that's vitally critical. What we really need to be doing is turning the tap off, not trying to create a bigger bucket in the health system. So we really need to be stopping the infections from occurring. And really, if somebody does get infected, it's not your fault. That is what epidemics happen. But what you can do as an individual is make sure that it goes no further, that you don't infect anybody else. So what we all need to be doing is making sure that we behave as if we are infected, and making sure that nobody else gets infected as a result of our behavior. So my behavior protects you and your behavior protects me. My mask protects you, your mask protects me. And that's how we should be seeing things. So what we're really wanting to do is to make sure that everybody understands the 3 Ds and avoids the 3 Cs. So the 3 Ds are dose, dispersion, and distance. So that means that by wearing our mask, we're making sure that we decrease the dose that our cough or our speaking might have on other people. Distance means that if we keep our distance as much as possible from other people, that we reduce the risk of other people getting COVID from us and us getting COVID from other people. And dispersion is the aspects of around ventilation. Outdoors is always safer than indoors. If you go to an event, rather choose outdoors. Go on a hike, go on a walk, jog, go and spend some time on a picnic if you're needing to see people rather than being indoors. And then avoiding the 3 Cs is the polar opposite. Avoid closed spaces, so roofs and windows closed. Avoid crowded places where you are in amongst a crowd and you're close to people. And then avoid contact, close contact, so where you would be close to people. So you need to be able to swing a cat. You need to be able to dance with gay abandon and not be worried about bumping into anybody. Then you're in a safe space. So what we really need to be doing is reminding people of what they can do rather than constantly telling them about what they shouldn't be doing. And hopefully then we'll get more compliance and less fatigue.
Yeah, it's going to be very complicated for authorities to implement these 3 Ds and avoiding these 3 Cs when we're talking about, places like Durban and Cape Town, where people go, when the Western Cape, where people go there and they want to enjoy the beaches. How can then the authorities make sure that these are implemented and people still get to enjoy their time on the beach?
Yeah, so I think that we need to be making physical ways that helps people comply, so that we're not only relying on people to think about it and comply. So allowing spacing, so making physical spacing differences, so putting ropes up for queuing and physical spacing, putting compartments up that says only 100 people allowed in this space, and then having some sort of counting. Encouraging people to go early in the morning, so making it harder for people to go when it's crowded. So opening up places to be free in certain time spots that would be that people would be unlikely to go normally, and making it more expensive or making it more tricky for traffic to get there. So I think that there are ways that we can amend behaviour that will help people to comply in better ways.
Yeah, Dr. Kerrin Begg, Public Health Medicine Specialist at UCT. I really appreciate your time on eNCA this evening.